Hi, I am Asna Khalid and I'm a junior researcher from Hussein Lab at Stanford University School of Medicine. Today, I'll be presenting our lab's research on the evaluation of a novel calcineurin inhibitor formulation to prevent post-ERCP pancreatitis. An ERCP is a routine GI procedure where a radiocontrast dye is injected into the biliary or pancreatic ducts through an endoscope. Around 1.5 million people worldwide undergo this procedure, and up to 15% of those patients develop an iatrogenic complication of post-ERCP pancreatitis. We recently discovered that a post-ERCP pancreatitis is dependent upon calcineurin signaling within the pancreatic acinar cells, and it is prevented by intraductal pharmacological administration of the calcineurin inhibitor tacrolimus, along with ERCP radiocontrast dye iohexol. However, the endocrine safety profile of direct pancreatic exposure to tacrolimus remains to be defined. The purpose of this study was to determine whether the intraductal administration of tacrolimus with ERCP radiocontrast dye formulation to the pancreas specifically poses any risk of acute, endocrine, or systemic toxicity. C57 mice underwent a surgical model of ERCP with intraductal infusion of either radiocontrast alone or radiocontrast with tacrolimus into the pancreatic duct. A third sham-operated group received laparotomy with duct cannulation but no infusion. To assess endocrine toxicity, IP glucose tolerance testing was performed at baseline and 2 and 14 days post-ERCP procedure. Blood plasma was also collected at 2 and 14 days after the ERCP procedure to test for systemic toxicities. We found that by IP glucose tolerance testing at 2 and 14 days post-ERCP, all three groups, radiocontrast alone, radiocontrast with tacrolimus, and the sham group exhibited a similar pattern of glucose handling, including maximal blood glucose and area under the curve. Further analysis of blood plasma samples collected at 2 and 14 days post-ERCP depicted no evidence of nephrotoxicity or hepatotoxicity. In the current preclinical study, the single-dose addition of tacrolimus to intraductal radiocontrast dye iohexol does not contribute to acute or subacute endocrine or systemic toxicity. These results suggest that this novel post-ERCP pancreatitis preventative formulation is safe for single-dose administration and, pending the next steps of preclinical safety and efficacy dosing, can move to the clinical trials.